Okay, so we have a right side pelvic girdle here. And first of all, it's comprised of 3 bones that have all fused. This is the ilium, this is the ischium, and this is the pubis, forming together the pelvic girdle. The anterior superior iliac spine is here. The greater sciatic notch is this big E-shaped notch here. The iliac crest is this entire ridge here. Then the iliac fossa is this here, and the posterior superior iliac spine is here. So, right, posterior iliac spine, anterior superior iliac spine, iliac crest, iliac fossa, greater sciatic notch. Then we move to the ischium bones. We have the lesser sciatic notch here, and then we have the tuberosity of the ischium, which is this area here. Then on the pubis, we have the inferior ramus of the pubis. Then we have the superior ramus of the pubis. And then we have the symphysis, and this is the attachment point of the symphysis. The symphysis is no longer here, of course, because this is only looking at bone, but that's the attachment for the symphysis. So the acetabulum or the acetabulum, however you choose to say it, is this socket here which joins all 3 bones, the iliac, the ischium, and the pubis, all joined to make a peace sign right there in the center of that fossa, and it articulates with the head of the femur. This is a right side femur bone. We know that because the head attaches here, and then you can see the articulation for the knee facing backward. So the right side femur. This is the greater trochanter. Then we have the head of the femur here. Then on the head is the fovea capitis here in the center. And then we have the lateral condyle. So since it orients this way, we know this is the lateral condyle here. Then we have the lesser trochanter, which is here. The linea aspera, which is this spine here. The medial condyle is this one. Then the medial epicondyle is here, and the lateral epicondyle here. We have the neck of the femur here. And then the patellar surface is this area right here. And then we have the patella, which inserts in that surface. That's it for the femur. We have a left side tibia. We know it's left side because when we orient it, the medial malleolus is on the medial side, of course. So, what we need to know about the tibia is the lateral condyle, which is here, and then the medial malleolus, which we pointed out earlier, the medial condyle, which is here, and the tibial tuberosity, which is right here. That's that tendon attachment point right there. Okay, now we have a right side fibula. We orient it by finding this point on the head. Put the point back towards your body, and then look for the lateral mediolus. So we know that this is a right side. And what we need to identify about the fibula is what we just did, the head and the lateral mediolus. And I think that's it for this bone. Calcaneus, talus, navicular, medial cuneiform, intermediate cuneiform, lateral cuneiform, and cuboid. These are the metatarsals. They are numbered 1, 2, 3, 4, and 5. Then these are the proximal phalanges. And then on 2 through 5, we also have a medial phalange, and then a distal phalange. On the toe, of course, since there isn't a third joint, we have just the proximal and the distal phalange.